I'm Dr. Srikanth Shetty, Senior Consultant and Head, Department of Cardiology, Sakra World Hospital. What is CRP? CRP is C-reactive protein which is secreted by the liver. Liver is stimulated to secrete CRP whenever there is generalized inflammation or any infection. Coronary artery disease or atherosclerosis is considered as a generalized inflammatory disease of the blood vessels. So therefore the conclusion that when there is atherosclerosis, there will be elevation of CRP levels in the blood. However, we need to understand that CRP is elevated not just by atherosclerosis but by any inflammatory disease such as rheumatoid arthritis or lupus, or by infections such as common viral infections, urinary tract infections, and so on and so forth. Patients who are obese, overweight may also have elevated CRP levels. If you have had a hard exercise, if you have run a marathon, your CRP level could be elevated. Therefore, one need not panic when you see the hsCRP levels being elevated if your coronary artery disease risk is otherwise low in terms of your presence or absence of high blood pressure, high cholesterol, diabetes, family history, and so on and so forth. hsCRP has some utility in patients who already have history of atherosclerosis, in the sense that those who have had a heart attack and now have an elevated CRP level, they may be at a higher risk of repeat events. Those who have proven atherosclerosis, they may be at risk of fresh events if they have elevated CRP levels. Therefore, a patient who has an elevated cholesterol or history of atherosclerosis and has an elevated CRP level, they need to have their LDL cholesterol levels more aggressively treated with statins. So, if you find your hsCRP levels are elevated, but if your coronary artery disease risk is otherwise low, do not panic. Thank you.